So I just want to give a hearty welcome to everybody today to the Indicio Identity Community Meetup for July 2022. As a public benefit company, Indicio is very happy to sponsor these monthly meetings to offer these community conversations about different things that are happening in identity, things to learn, things to share, a place to ask questions, and hopefully have some good conversation. And, again, walk away with something that you might have something that's new to you today. So welcome to everybody, especially welcome today to Keela Shatzkin and Ken Ebert, the Cardia co-working group chairs. Keela is from Shatzkin Systems, and Ken is the CTO here at Indicio. We also have RJ, correct me, I always say Reiser, it's Reiser, right?
Yes, it's Reiser. Thank you.
RJ Reiser, the Chief Business Development Officer at Liquid Avatar. They have a very cool wallet that y'all can download from the privacy of your own home if you'd like to see it in action at home. But the Liquid Avatar wallet is a Cardia-based wallet. And he will be demonstrating how the Cardia workflow uses this technology in the wallet. Mike Ebert is also on hand to explain a little bit more about some of the agents that are going to be used in the demonstration. And I think that's where we're at. So what I'll do from now is I'll toss it off to Keela now. She's gonna, her and Ken are gonna discuss a little bit about Cardia, where it came from, what it is, where they're going, and then they'll toss to RJ and Mike for the demo, and hopefully we'll have an opportunity for some questions at the end for folks. I'll also keep an eye on the chat, so if you have questions, feel free to pop them in there. But this should be an interactive kind of conversation, so if you have a question, put a hand up, put it in the chat, come off mute, whatever you want to do. This is a more casual than your typical webinar. So with that, I will pass it off to Keela. I'll stop sharing and pass it off to Keela.
Thank you. All right, let me share my screen here and we will get started. Are you all looking at my presenter mode?
Yes.
Yes.
Excellent. Okay, cool. So, so thank you, Helen, for both organizing and doing our introductions. We're gonna jump in. I'll maybe just take this first one and then pass it off to you, Ken. So the first thing to talk about as we get into what is Cardia is that while we're skimming the surface in today's meetup, we have issued a white paper that goes into far more detail than we'll be able to cover in an hour. And this is available for everybody to review, to dive into. If you have questions, once you've had the chance to review, we really encourage you to come ask those questions in our working group, which meets on Thursdays. We'll talk about that later, about how you can get involved. But there's a lot of information to dissect here. So that's available for everybody. And we would really encourage that you take some time if you're interested in today's discussion to dive into this document. So with that, Ken, I'm going to pass the baton to you to kind of go over why and what are some of the roots here to get us into the Cardia conversation.
Okay. We started off prior to verifiable credentials being available. We started off with federated identity systems. They're centralized. They have private control and ownership of the data, and it's usually not owned by the person whose data it is. And trust is limited to a single domain. Examples of this are things like Meta. When you log into Facebook, they own your identity and they control it, and you pretty much follow their rules, and it's limited to whatever identity has been incorporated into their platform or into their partners. So it's a very limited sphere. But each time you participate in one of those types of ecosystems, your identity gets recreated. It doesn't get shared. You don't control it. Every time you create a new account with a new website or a new platform, you're creating a new copy in their hosted environment, and they control it, and you're limited to whatever they allow you to do. Most of those domains are not interoperable. They don't connect with each other. They don't allow for easy transmittal of the data that's about you to any other type of organization outside of their small worldview. With decentralized identity, the focus shifts from each of those platforms back to the individual. And the individual has an identity, and they control where and with whom they want to share what parts of that identity. And so the center focus becomes the individual, and they're able to provide the consent to share their data and do it in a way that's compliant with lots of regulations like GDPR and other similar types of regulations that control how identity should be managed. My identity can be shared in a manner that takes it from the issuer. Let's go to the next slide. The whole ecosystem consists of somebody who's issuing the identity, a trusted source of that type of credential, a government, a bank, a large organization, a small organization, whoever you trust issues that credential to the holder. The holder has an ability to keep that in their wallet, whether that's in a cloud wallet or whether that's on a mobile device. And then they're able to share that verifiable credential with a verifier. And they do that in a way that is secure over a DIDCOM communication channel, which is similar to a VPN. And it's anchored to a ledger. The ledger has the signing keys of the issuer and the schemas that describe what the data looks like, so that you know cryptographically what the data looks like on the other side. It incorporates privacy by design to solve that scaled digital trust problem. And businesses and governments use this to take care of some of the issues that they've had previously with identity, and allows them to do that in a way that can be cryptographically backed up. Keela, you want to talk a little bit about health credentials and why digital credentials might be a better approach?
Sure. So this is where we're going to sort of transition from the general concepts of decentralized identity and verifiable credentials to Cardia specifically and its play in healthcare. So what we were faced with, right, is the challenge around being able to do verifiable credentials in a trusted network, interoperable, without the ability to tamper with those credentials, right? If we think about the COVID use case, which was really what sort of leapfrogged Cardia into the sphere that it is now, it was really around the challenges of verifying somebody's health status, whether that was through lab testing or as it became available through vaccination records. And so there was a lot of fraud happening there with, for example, you could think about somebody sitting in the middle with a file editor, maybe changing some dates and changing some names, right? And this ecosystem allows that to be prevented. It's got that trust built into it. And it also allows the support of the privacy that's required for sharing health information. So when we talk about the sort of expanding on what Ken was just describing around an issuer and a verifier, let's talk about it in a little bit more detail with this use case around health. So we have our person or patient here in the middle. They're sitting with a holder or wallet, digital wallet app that they are going to bring to their issuer. They're going to establish that secure connection with the health issuer. In this case, again, this might be a lab. This could be their healthcare provider, anybody who has that health credential that they're looking for, whether that's a lab test or a vaccine or something similar. And so they're establishing that connection. Similarly, this issuer has registered themselves on the ledger as a trusted issuer of health credentials. And so they're anchoring themselves to that ledger. They're issuing their keys and DID information so that they can be verified on things that they've issued to holders or patients down the line. And so they're putting that cryptographic information that allows access and verification down the line. So the patient or holder is going to connect with their health partner. That health issuer is going to then issue them a credential. When they issue that credential, again, it's issued with data that is linked to their anchored the issuer's anchored identity on the ledger, so that when the patient person is going to share their health status with a verifier, when that verifier scans their credential and they've been able to establish, again, a secure connection channel between the patient person and the verifier, that is allowing the patient or the person to decide with whom they're willing to share their credential, and also specifically what information is being asked to be verified. So they have some control and visibility into what information is being exchanged with that verifier. And the verifier is able to check verifying on the ledger the issuer of the credential. I know that was a lot of verifying going on, but they're able to sort of double check that the thing that was presented to them is authentic. It has not been tampered, because the cryptographic signatures match those that were published by the issuer on the ledger. Ken, do you have anything you want to add to that?
I noticed that your vocabulary indicated something that was really, I think, crucial to this whole process working as well. You talked about a patient while you're talking about the medical side, and you talked about a person or a traveler on the other side. And that's because those two worlds don't normally work together. There are very few airlines that have direct integrations with healthcare systems. And the idea of using the patient or the traveler, the person in the middle, to take the data and hold it and be able to share it in a way that meets both sides' requirements, the patient relationship with the healthcare organization and the traveler relationship with the government or airline. And that's really crucial to how making this effectively work, because there isn't a direct integration between an airline back to a healthcare organization or back to 10,000 healthcare organizations around the world. The trust is established when on the issuance and putting the public keys and so forth on the ledger, but the data is held in a secure way that can't be tampered with and then shared with the other organization on the other side. So it's a indirect integration by using standards and protocols on both sides of the issuance and the verification process, but it allows for a low cost method for a government or an airline to integrate with thousands of healthcare organizations. As long as they trust the issuer, they can trust the data that they receive without doing a direct costly integration or a really time sensitive one. I know how long it takes healthcare organizations to directly integrate with each other, and they're already familiar with the topic. And having an outside organization like a foreign government or an airline try to integrate with that is beyond achievable without massive budgets being dedicated to each integration. But by allowing that to occur through the traveler or the patient, whichever side you're looking from, that helps that process go forward in a very trustworthy way and allows for that data to be accessible for the people who need it at the verification end with the consent of the traveler involved. So excellent explanation. I thought you did a really good job of that.
Thank you. And thanks for your clarification. Okay, moving on, let's talk about how Cardia helps to facilitate this and what's sort of within the Cardia ecosystem that is available to the community today. So there are a bunch of agents. I'm just going to preface this by we're looking at potentially renaming some of these agents. So this is their current naming, as you will find in the Git repos if you were to visit them today. So these are the components. We have a health enterprise agent, a government enterprise agent, verifier mobile agent, and a holder mobile agent. The health enterprise agent in this case was an issuer. Sorry, we have a mailman here. My office managers are introducing him. So we have a health enterprise agent that is the issuer, right? In this case, that might be the lab that we were looking at in the trust triangle just a moment ago. We have the holder agent that is the wallet, and we'll see RJ's version of their digital wallet just a little while from now. In this case, the government enterprise agent can serve two roles. It can both verify and issue what's called a derivative credential. So for example, the government agent might say, I'm going to check the health status and I'm going to issue a simplified credential that just says, they're good to go, we've checked their stuff. And so anybody else downstream verifying might not need the health details. They just need to say, did our trusted government enterprise that becomes the issuer, did they give them a good thumbs up and we're okay to proceed? So moving on, the other component here, sorry, one second. Moving on, the other component that is underpinning all of these interactions is schemas. And so the schemas are effectively definitions of what a credential contains, so that all of the people communicating about this, can establish rules about what to expect, its structure, the data that it includes, etc. Sorry about my dogs. And of course, this is all sitting on the Hyperledger Indy network as the ledger. Ken, anything to add on this one?
The important part, I think, are the agents that Keela referenced. Agents indicate software that acts on behalf of an organization or an individual. That's why they're called an agent, because they have fiduciary responsibility to the organization or person they represent. The ledger is boring. It's a good place to anchor things, but if you want to focus on where the action is, it's between the interactions of those agents.
Excellent. And speaking about those interactions, there is another component that helps support Cardia here, which is really quite important to helping to automate a bunch of these interactions, which is called machine readable governance. And so machine readable governance is defining, for example, what issuers are trusted in this ecosystem, what verifiers are trusted to verify, the role that each of those entities play in these interactions and communications, and also defining, for example, what would be an acceptable credential. So when you verify that credential, did it pass your criteria? Right? Was the COVID test negative? Was it within a certain look back period? All of those rules that we're establishing for sort of what's okay and what's not okay in this ecosystem are managed by machine readable governance.
The machine readable governance offers guidelines and suggestions and so forth that can be strictly interpreted by the software itself without a human having to figure out what a COVID test result looks like. Most travel agents don't know what that is and how to interpret it, so it can help with that. It can help guide a holder to know what to expect and who to trust. But it doesn't inhibit any of the ad hoc interactions or a second set of machine readable governance being used in another type of ecosystem with a issuer, verifier, or holder might want to participate. So it's very flexible.
And I think that when we look at Cardia, the machine readable governance really plays a huge role in this. If you were to think about the human interactions that exist today, right? Like the rules change all the time, especially if we have a retrospective analysis of what's been going on with COVID, right? Today it's that, you had to be tested 72 hours before, now it's 24 hours. And if you have a staff of people, they could have missed the memo that the rule changed, right? They were a little late to work that day. They didn't get the memo, and they didn't get that they need to be applying other logic. That all gets eliminated by managing it through machine readable governance, because it's centralized and then can be sort of farmed out and cached by each of these agents or software code blocks. And the other powerful thing is, because it can be farmed out, but is managed in a slightly more centralized way, it also allows for offline verification, which is super critical when you think about trying to move these kinds of solutions into the real world, where I'm in a new country, I don't have access to the internet, I can't connect, and being able to make that work. So that's a little bit of Cardia at a glance, and we've talked about sort of the challenges around tampering and making that tamper-proof, right? Eliminating paper which can get lost, could be picked up by somebody else, etc. This really is trying to build a privacy by design and tamper-proof solution that allows the intersection of different enterprises like healthcare and travel, for example, where they did not previously have a need to talk, and they definitely don't know each other's rules, as Ken pointed out.
I think as we go through this whole example, I want people to remember that although Cardia, the current software implementation is focused around COVID and travel, that's really a flexible system. And as you watch the demo, think about how could this be applied to other use cases where any medical record could be shared with a patient, and then that patient can share it appropriately with another healthcare provider or with an employer or with travel or with any other organization. A sports star might need to share his results about his performance in athletics or something like that. But the technology is very, very flexible. Just because we picked COVID as the initial use case, don't lock your brain into that. Think about the additional possibilities and additional ways that this can be used.
Yeah, and we'll cover a few of those if you don't make the leap during this demo. So so we did successfully trial this in Aruba, and maybe Mike, I'll pass the baton to you to talk about this briefly.
Sure. So Aruba was one of the very first, public use cases of the Cardia software. They asked us to help them get their tourism back up and running after COVID hit the world. And something like 80% of their economy relies on tourism. And so when travelers didn't want to travel because everybody was sick and you had no way to know who was healthy or whatever, it really impacted their economy. And so partnering with CETA and Indicio and Aruba, the three organizations or groups sat down together to say, how can we make sure that people can come to the island? And using Cardia, there were schemas established that said, here is how you can pass information about COVID vaccines or COVID tests and share that with the Aruban government so that Aruba could determine is a traveler presently healthy, and if they met all the other normal requirements for travel, and be able to verify that data and then issue the derivative credential, a credential based on other credentials and information to say, we have certified that this information is true and accurate. And as the government with jurisdiction over our own sovereign boundaries and the immigration process, we certify that this person can now come to Aruba. And so after examining the health data and the travel requirements, they issue a trusted traveler credential, and they hand that to the traveler. And then the travelers were able to, work with the airline and get on the plane and fly to Aruba. And along the way, present their trusted traveler to say, yes, I've met the requirements to travel and to safely come to Aruba despite COVID. I've been tested, and so therefore I know that I don't have COVID, and I can prove that to people. And so I'm a safe person to come to the island. I'm not going to infect everybody, or at least not nearly as likely to infect everybody when I come. And even on the island, they were able to use that credential that says they were healthy to do things like enter a crowded venue, or for an event, or to go into the casino on Aruba was particularly interested because they had very strict requirements about how many people they could let in and so on, to make sure that that confined environment wasn't going to get everybody sick. And so that trial, they've actually done a couple different phases. The first phase was to see if we could get to use credentials at all. And then the second phase was to use health data from the United States. And so both of those trials were successful. They were on a limited basis, but Aruba is continuing to push forward to roll out those credentials to general use and to add additional capabilities. And that's kind of a summary of how things went in Aruba.
Thanks, Mike. We do in this deck, which will be made available down the line, there is a video of those interactions, which is a nice way to see sort of the trust triangle in action about how people interact in the order of operations there. I think in the interest of time, we might skip this because we're going to do a live demo for you all in a few minutes. So it will be here for you to look at another time. Moving on, we do have a bunch of Interop-a-thons that we've been doing in the Cardea community. And so I wanted to take a few minutes and just walk us through how we've been developing and moving this forward with the help of our Cardea community and the Interop-a-thons that we've held. So the goals are for these Interop-a-thons to drive adoption and participation. RJ, of course, has been a really active participant, and he'll be able to highlight some of that during his demo. We're also trying to facilitate connectivity and interoperability, to grow the community, and to share our successes and our challenges so that we can continue to overcome those and drive adoption across the board. I think it's important to understand that while this is relatively new, that means the more the merrier. There's room for everybody. We really want to encourage participation and make sure that we're all successful, because without more people engaged in a verifiable community, right, we're not going to be able to implement widely. So that's really important, I think, for our success and our shared success in this space. We've been holding our Interop-a-thons on Zoom, and we've been leveraging breakout rooms to set up sort of isolated testing zones for different organizations that are participating. That's gotten a lot of positive feedback. It's certainly potentially an improvement from the days of in-person Interop-a-thons where everybody's sitting around screens saying, oh, I have glare, I can't really see, pointing and touching, and we're in a new age. So Zoom has really helped us with these Interop-a-thons, making them collaborative and accessible for those who might not have budgets or time to travel to a single location. The other thing is about structure and format. So we have sort of two phases of each of these Interop-a-thons. The first is to test and troubleshoot. And I say troubleshoot because we really do some hacking. It's not just like, oh, it failed, we're done here. We try to overcome those hurdles, again, sort of sharing our successes and our challenges and trying to tackle and overcome them together. So we do that against our reference code, which is hosted by Indicio for Cardia. So it's an open testing platform, and it would be available to those who want it now, for example, between Interop-a-thons. You just need to reach out and let us know so we can get you credentials. And then also we try to match participants of Interop-a-thons with the different components they've brought to test. So for example, if RJ has a wallet and somebody else has a verifier, that's a great combination to bring together for a specific participant to participant testing cycle. And so that's sort of the two phases of our Interop-a-thon. We do have before the event activities. So we're trying to reduce barriers and increase participation. We have reference code available in advance. We've been hosting office hours for anybody that would want help to prepare for those Interop-a-thon events, as well as in our working group on Thursdays, we will do, leading up to the Interop-a-thon, we'll do code walkthroughs. We'll cover specifically what's new, specific use cases, et cetera, around that next Interop-a-thon. And then during the event, we're trying to discover areas of friction, again, to help clarify standards and increase interoperability, and interpretation of code standards sometimes can cause some issues if something's a little bit ambiguous. And so the point is to highlight those and together as a community move past them. Those cycles include testing connectivity. So for example, there's some changing in the protocols of those connections to out of band. And so we've been working on that in this community. It's an opportunity for those who are maybe not just Cardia focused, but they can also come and just test their compatibility in those new connection methods. But then we also focus on the Cardia specific workflows around credential issuance, verification, holder apps, et cetera. So all of those components and agents we've talked about already. Ken, do you have anything you want to chime in on from our Interop-a-thon experiences to date?
I do think that the Interop-a-thons have revealed ambiguities in some of the specifications that have been then taken back to the community for clarification. They also indicate what some of the platforms have moved at uneven steps, and so some have moved to the newer protocols and reveal gaps between existing and new protocols. So it's been a really useful thing at the core level of the Aries community, finding out things. It's also revealed friction in some of the workflows that were being proposed by by Cardia. And so we've been able to enhance those and remove some of the obstacles that make it difficult for people to use it. This is not only helping drive the technology forward, but it's also helping explore additional use cases, because different people come at it with different perspectives. And so it's been very, very useful and very low effort on part of the participants. They've been able to come in, spend a couple of hours and get a successful test or debug through problems as well live with the help of people who are expert in the system. So it's been a very useful and cost-effective way to move the technology forward.
Excellent. Okay, so now, drum roll, we're going to pass the baton to RJ and Mike to walk us through a demo using RJ's wallet from Liquid Avatar and some of the Cardia code for the other agents.
Great, thank you very much. Hold on, let me get me set up here, and I don't know why. There we go, this is what I want to get to.
Let me know when you're ready and I'll stop sharing.
Yeah, if you could, please. I am ready. Bingo, hit share. Okay, so on my screen, you should, well, first of all, hello everyone. My name is RJ Reiser. I'm the Chief Information Officer at Liquid Avatar. And we were, I guess, one of the founding members of Cardia, along with a lot of other Linux Foundation organizations. And I really, really enjoy the participation with Cardia because of the reference code. So everything that you guys see here today is based off of the Cardia reference code. And so as a result, we are interoperable with open standards and then also everyone else that meets the Cardia reference code. And so you'll see on the left-hand side, this is our wallet. It is publicly available today on the right in an app. On the right-hand side is the Cardia enterprise agents, and I have 3 of them. I have the health lab, which can issue a number of credentials. I have the government enterprise agent, and then also a verifier. And I'm going to walk through all 3 steps, which is what Keela showed us, where you have a lab that issues a credential to a user. They use that credential to go to a government to get a trusted traveler pass, and they use that pass to get access to a restaurant or a venue. The key here is it's all identity protection. It's putting the self-sovereign identity, which is put the user in control of their data. There's going to be times where they're going to want to share some data, but they're in control of it. Other times, and I'll walk through this flow in the demo, you're not going to want to share data. There were a couple questions in the chat, and so I'm going to click on a button here that says view all for our credentials. We, Liquid Avatar, believe that you're going to have hundreds, if not thousands of credentials once the adoption of all of us building to the same standards takes off. There'll be thousands of credentials. And so we have filters that we use as avatars that you'll be able to filter your different credentials so that you can easily find them. But I'm not going to use a filter. I'm just going to go to view all and look at all the existing credentials that I have. And the question was, how do we know that this individual is the correct individual for a credential? So in our app, to get access to your app, your password is your biometrics. There's 3 other fallbacks, but we tie it to your biometrics in your image. And the base credential that you get is a phone credential. And as you look at it, the only information that was provided when I created the account was my phone number and the biometric picture. So as we were doing this Aruba pilot, and the lab that we are working with is, how do we make sure that the individual we give this credential is the correct individual? I think in the chat it said the identity binding. There's lots of ways to do this. The one way that we're doing is based on biometrics. So the lab will actually look and have a biometric challenge and say, all right, this is the correct person that owns the wallet. I saw them do their biometrics. And then they're able to issue the credential. Another question in the chat was, how do you store additional information? So, we are at Cardia, we're building all this different type of schema for credentials around the medical industry. But when you start to say that there's going to be additional data, you can either store it like we did with the image that isn't on the blockchain. It points to a secure server that has that image. Or you can use a credential to get access to a third-party site that has the data, the angiogram or the other data. It's stuff that we've all talked about in our meetings. And that is, information that is, as this industry matures, we have paths to get there, but it's not always fully complete. So let's move over to the demo. I'm going to hit the close button. And I have already created, as you can see, there's a medical release credential. I use that to prove who I am in the Cardia environment. Everything that you see, the QR codes that I'm going to display right here, is not a reader. This actually starts a workflow. And let me hit refresh. I may have done something in my setup. So to display the out of band, there we go. Sorry about that. And all I'm going to do is scan the QR code. It is easy. Once I have my credential, it is easy as scanning QR code. And in this QR code, it asks for the connection, which I accepted. And then it says, hey, do you have a medical release credential? And I want you guys to watch these fields here in the enterprise agent. I already have the credential. So I'm going to say I already have it and hit send. And then these fields get populated so that, I got to say yes. And this goes back to self-sovereign identity. I can decide what fields to send or not send to the lab. And as I hit send, you can see that all the information went across. I'll hit OK. In the workflow that we're doing, I'm going to issue a lab result credential so I can get a trusted traveler. There are many other credentials that will be able to be issued as Cardia continues to mature. But let's go ahead and go issue a lab result. Now, Keela mentioned the governance. So this is the key. How do you know who the issuers are? How do you know what credentials are accepted? And that is the governance that comes along with this whole ecosystem. The governance can also go down to an attribute level so that you can automate some of the processes. For example, we know that with the PCR test for COVID, we need to have the observation and the specimen within 24 or 48 hours. So the lab technician would enter in the correct details. We also know that the governance is going to look for the result and needs to be negative. Obviously, all these other fields are important. And depending on the scenario that you are using the credential for, you'd have these things filled out and you would tweak the governance to look at certain fields depending on your use case. I'll click on submit and you can see that a credential was successfully sent. And there it is on the left-hand side. This is all hitting the test net for the Indicio identity blockchain. I'll hit accept. And then you'll see that my wallet will update here there it is with a lab result. That is that negative test. So from there, I'm ready to travel and I will then connect with the government agent and say, hey, I would like to go to this destination. The requirement is to have a PCR test. The government agent starts a workflow. This is all about the identity binding and a high assurance level. Again, I go back to my scanner, scan the QR code. It shares data with who the individual is. Obviously, these fields will have a little more detail to it when we roll it out. But this is our government agent. This is the correct agent. I'll accept that connection. Now, here's where the agent's going to ask me for more information. It'll pop up here. They want more demographic information. This is where I can take control and say, in this scenario, I can say cancel. I'm not sending you any information. Your only requirement is that I have a negative PCR test. So that the government agent would go to the contact, they would find me and say, okay, you're right. I'll issue a trusted traveler pass if you have the correct PCR credential, which here's the lab result. It's within 24 or 48 hours and it's negative. You can look through this information. Here it was 7:25 at 11:40, negative. And I'll scroll down. I can eliminate some of the fields as needed and hit send. And that has been verified. And I hit OK. And it'll pop. Oh, it already popped up. It says that it offered me a new credential, which is the trusted traveler. I click accept. And then you'll see how my wallet will update to the trusted traveler.
So a couple of comments, RJ, just to
Please.
bridge to healthcare. So where RJ was typing in the lab result, you can imagine that that would be a translation from a standard healthcare transaction that already exists. Those interfaces would be translated into the defined schema that we've outlined for lab results. Again, neutrally, not COVID specific lab results. Any lab result is a neutral schema for that purpose. And so that's important. And then the trusted traveler that we have here was named specifically for the COVID use case, but it's this concept of a derivative credential that says like you've met the criteria and you're good to move forward. And therefore RJ isn't sharing his lab test with the world. He's sharing that his lab test, that his requirements for being okay for, in this case, travel have been met. And nobody else needs to know whether it was a lab test or vaccine or whatever.
This code was all generously donated by CETA after they did their workflow in Aruba to form the basis of the Cardea ecosystem. There are a couple names that we probably want to change to apply to medical more generally. So the fact that the verifier and derivative credential issuer is called the government, it's not always a government that will be doing that. And where the derivative credential is called a trusted traveler, it may not always be used for travel. So we have a couple names to iron out as the ecosystem matures, but the software is all there and publicly available so that, you know, if you can't wait for the name change, you can actually get started and use it, even though, you know, it's not necessarily going to be a government that's doing this stuff or used for travel, but you could use the schemas and the code to get started and rename things if you wanted to right away. So we felt release it early and then iron out the bugs rather than wait till it's perfect for medical later.
Okay, so the final step then would be to get access to a venue or a restaurant, which is the verifier. And what, just to reiterate what was just mentioned, is the restaurant doesn't need to know whether any of my health details, just that I qualify that based on the regulations that I can go to the restaurant. And so that is what this is that we're just leveraging a trusted traveler pass, and they do not have access to my medical details. And QR code just scanned with the verifier. I will hit accept, and it's going to then ask that I have the proper trusted traveler credential, which you just saw pop up. I'll click on the trusted traveler credential. I'll hit send, and now it updates to say the trusted ID is 1B3A, which if I go and open my credential, you'll see that that is the correct credential. And click on it. And scroll down to the identifier, which
Was up a little.
Yep, did I just pass it? There it is,
Yeah.
right here. So that is the full cycle of the workflow where you can see how we're protecting PII. We have a high assurance on the binding with the identity. But more importantly, right, is the interoperability and us building from the reference code. And so I really encourage everybody to attend the Interop-a-thons, but more importantly, the workshops before the Interop-a-thons. This is a very good group that will help kind of troubleshoot and help you guys with your implementation so that when we get to the Interop-a-thon, things run a little bit smoother. What I loved about this group versus some of the other groups is that we roll up our sleeves and use the code. And you find so many other issues or problems with workflows than you just do sitting around a table and coming up with a document. And so this is heavily focused on a reference code and also interoperability. So I welcome everyone to join and reach out to myself or anyone else in this working group. And we'd love to work with you guys. So thank you very much for your time.
RJ, if you just stop sharing, we'll jump in. We have a couple more things to touch on before we're done here.
I wanted to point out one thing in the demo. As you looked at RJ's agent, you can tell that it's a compatible agent with Cardia, and it works great with it, but it's also used for many other use cases. You can see a park pass and some other aspects of their agent. And that's the ideal scenario where it's an agent that is usable for more than one purpose. It is fully interoperable and supporting Cardia, but it has other uses that it can be used for as well.
All right, I have a couple more slides and then we'll try to get to some of the questions that we've seen that we haven't fully discussed. So as we hinted, while COVID as a use case is kind of what launched and leapfrogged Cardia forward, again, with the generous involvement of CETA, we have identified that there's just a ton of use cases for this concept and this implementation. And it starts, of course, as we did with travel and tourism, given the world that we were in at the time. We've seen its use case and applicability in sports and athletes management. For example, the concept that you're at the combine and you're doing official stats and you're going to go into a draft, for example. All of that stuff needs to be verified. Ken hinted perhaps you're testing for performance enhancing drugs and things like that. All of that is really important and needs to be tamper evident and exposed. Also, clinical research. Clinical research is an interesting space because it has some additional consent requirements. There's some issues around the identity and making sure that it is appropriately handled for those use cases, which are clearly defined and a little bit more complex than the generalized healthcare use case. Also, education health requirements. So just as we've been talking about, for example, health data for the purposes of travel, if you're a student attending a school, they also have healthcare requirements. So for example, the meningitis vaccination, you might need your smallpox vaccine. We just had a case of polio in New York, so there's another one to add to the list. And so that's an interesting one. And similarly, employment health requirements, which we'll dive into in just a second. And then we've started to hint around consent and release of data and sharing of information as we move into a more mobile and technical driven healthcare space. Managing consent and who can access your information is going to be really challenging and critical. So diving into this employee health requirement, we're sort of explaining this as an extension of the Cardia use case because we were so focused on solving our current challenge at hand with COVID. We want to make sure that we have a clear path to extend what we've already built and what's available today to these use cases that have applicability right now. One is the health verification for higher education or employment. We've kind of bundled those together because they're really similar. So for example, if you're a healthcare employee, you might have a requirement to get a TB test on some regular schedule. Same for COVID testing, for example, maybe to come back to work after you've been positive. You have vaccines. So I mentioned meningitis, we have COVID. If you're a healthcare worker in the US, you need to be vaccinated for influenza or the flu on an annual basis. And so these data sources come from a variety of places, and that makes it a really good use case for these trusted issuers to be connecting with the holder, who would be in this case a patient, and the patient being able to take that as the employee to their employer or their school. Additionally, drug testing, again, for the sort of the purpose of employment, would be another really clear and applicable use case for what we've built today. These are driven mostly because the schemas that are the underpinning for these interactions were built in a way that make them neutral to the use case. So we talked about COVID, but the schema is for a lab result neutrally, or a vaccine credential neutrally. So you can plug in any lab or just about any lab or any vaccine to be able to change the content of that credential to apply to these additional use cases. So we're exploring these, and over the next couple of weeks, we'll be shifting to try to demo and walk through some of these examples in our working group. Ken, anything to add on these extension cases?
I think that many of them are using the same exact basic code that we have in place right now. And like Mike said, it's relabeling which agent represents what organization. So instead of government, it might be university, or it might be employer. But the schemas were designed to be generic in the first place. The agents are generic in the first place, except for their names. And so that some of these are very achievable in the very short term to extend to these other uses.
Excellent. So put a few plugs in here. So on a more formal note, how you can participate. We've put both in the chat, and here for you on this slide is the Cardea.app website that has important links to a variety of things, including Git, including work group recorded sessions so that you can listen in to previous conversation. We also have a groups.io distribution email that keeps people up to date on those meeting agendas, as well as upcoming Interop-a-thons and things like that. There's a Slack channel through Linux Foundation Public Health. We have Twitter and this white paper we mentioned at the open of this discussion. And as mentioned, we do these Interop-a-thons, and RJ really did a great job explaining why they're so beneficial. And he's, a real vendor out there in the world implementing these things. And so our next one's scheduled for October. This meetup is timed well. If you wanted to get involved, you probably have enough time between now and October to roll up your sleeves and dive into the code and be a participant at our next Interop-a-thon. We meet every Thursday as a working group. Ken and I co-chair. We do have a sort of loose agenda. The first Thursday of the month is great for beginners to come and learn. We go through very similar conversation we just had today to try to reduce the barriers to entry. It'd be great for introductory. If it's your first time, first Thursday is a great time to join. The second and fourth Thursday, we have slightly more technical deep dives. And the third Thursday of the month is for those who are engaged. Maybe you're having a hard time understanding. We want to improve our marketing, improve our outreach, talk about what other communities might be aligned with our mission and what we're trying to solve here, and sort of expanding that community. So we really encourage you all to join. The best place to start is the groups.io and Cardea.app. And Helen just put in the chat for you the way to get the meetings on your calendar if you'd like to participate. So with that, we have about 5 minutes to tackle some of the great conversation that's been happening in the chat. So we'll try to save that chat so that we can dissect some of it in the working groups, in the technical discussions, so that if we don't have the time here, we will spend time tackling each of these, as they've been really interesting for the conversation and sort of where we're going. Helen, I saw you come back. Is there anyone that wants to ask a question? There's been a lot of back and forth in the chat, so I'm not sure if we didn't answer any that we want to re-raise here now that we've got a few minutes. Don't be shy.
I saw kind of two basic categories of questions in the chat. Some of them were about the basic or advanced general features of wallets and credentials and ledgers, the general landscape for verifiable credentials. And the other questions were some related specifically to the medical use case. One that one area where we're trying to make some progress in the coming months or whatever is to the interaction between credentials and fire records. Keela, that seems to be a specialty of yours. So
yeah,
maybe we want to chat a little bit about the differences between credentials and fire records, or maybe what could be done to kind of bridge the gap there.
Yeah, absolutely. So the challenge with schemas in this ecosystem is that because they're something called a non-creds, they have to be flat, meaning they can only have one, right? There's no nested elements. And if you're familiar with the FHIR standard, it contains a lot of nesting. And so that is the number one challenge in using a FHIR template as the schema, is because of that nested data. It doesn't translate one-to-one just yet. So it is a conversation that we've started to sort of earmark for our community to tackle. As I hinted in the chat, I think that the bridge that allows for the intersection of verifiable credentials with FHIR data exchange right now is that the credential contains potentially both consent / permissioning and the pointer to where to go ask for the FHIR data that exists. So that's, I think, a viable option, that the credential sort of is the key to unlock the FHIR query. It tells you it's sort of where to go, and the key that lets you get it back from that ultimately that issuer or data holder. And then you would use FHIR protocols sort of outside of this framework through normal healthcare interactions. That, I think, is the sort of fastest path to an implementation. I do think we will need to tackle this, because I think the idea that a FHIR resource is a sort of nice little package that could be some kind of credential is a really interesting way to handle this, because you can take that data with you. You could, for example, have an identity credential that is compatible with FHIR. So those are some of the conversations we're having in our working group. And I think that bridge solution gets us there a little sooner.
So both types of questions, the fundamentals of verifiable credentials and agents, and also medical specific applications, both types are welcome at the Cardia meetings. And as they mentioned, we have a cadence where there's some meetings that are kind of introductory or related to marketing or medical, and then we have some others that are kind of technical deep dives. And the schedule's here on the screen, so come and ask those questions, and we could, you know, put on the agenda a meeting to kind of go over something in depth, more than just a quick answer in the chat. So come express your interests and tell us what you want to hear about, and we can maybe make plans to address it where it fits in best.
So I'll jump in here. We're at time here. Thank you so much to all of our speakers today. Thank you for presenting. This is an incredibly valuable overview of Cardia. Great demonstration. I really appreciate it. Keep the conversation going. Again, please get involved. The Slack channel is a great place just to pop in some questions as well for the LFPH, the Cardia channel in Slack. Also, if you have any other ideas or interests or topics you would like to see the Indicio identity community meetup address, aside from Cardia, but anything else in the community, we've had all of our recordings are on YouTube from our previous meetups. But if you have any other thoughts or ideas or interests, please don't hesitate to reach out. You can reach me on all of the channels, Helen at indicio.tech, and all of the social channels you might want. You can find me pretty easily. So feel free to reach out. Hope we got some questions answered. And again, thank you for the awesome demonstration from RJ at Liquid Avatar. Download their app. It's really fun to use. It's really easy to use. It's one of my favorites. So definitely worth the download there. Thank you so much, RJ.
Thank you, everyone.
Mm-hmm.
Thanks all. Looking forward to seeing you on a Thursday.
Yeah, see everybody here next Thursday.
This Thursday.
This Thursday. Yeah, 2 days from now.
All right, see you guys soon. Thank you. Bye.
Bye.
Thanks all.
Yeah.